which is supposed to cure or rather help diabetics in terms of erectile dysfunction. Can you just tell us what is that product? Because we get a lot of emails regarding this simple issue of erectile dysfunction.
Yeah. Basically, as you know very well, if we are talking erectile dysfunction only connected with diabetes, then it's purely and purely because of the blood circulation, nervous system and muscle tone really collapsed in the zone where the reproductive zone fundamentally, right? So even if diabetics have good male hormones, they cannot have firm erection because these three are not functioning properly. So for diabetics particularly, it is very fundamental to keep the sugar stabilized and work on the root cause, which is metabolism, so that these toxins don't attack blood vessels and the nervous system and this and that, you know. That's very important, first, fundamental. And second, there is this a simple combination which somebody can try. I have given it to the people and they've found a good improvement in their situation with that combination, which contains ashwagandha, 1 teaspoon. Then it contains kaucha. You know, kaucha beej is mucuna prunes. Ashwagandha is Vidania somnifera. So
and these are vegetables.
These are all the herbs you can get in any Ayurvedic stores. This is just normal. I'm just giving this formula which we use for people's benefit. Okay. So ashwagandha 1 teaspoon or kaucha 1 teaspoon or gokshur 1 teaspoon. These three combined together. Take it 2 times a day, and I have seen in every kind of erectile dysfunction a good change happening within 3 to 6 months. It takes very long time because it is working from inside and it's slowly. Anyways, nothing works for them. So they see definitely a change.
I see. And how many of your patients have actually reported that it has improved their system?
I would say,
in terms of percentage?
Yeah, I would say 50%, yeah.
50%?
Yeah.
And is there any particular age group that it works on? Because nowadays
younger age is better. 70 plus is very difficult.
I see.
Very difficult. But if it's under 60, 45 to 60, I would say at least 70% result is there. But when there is more than 70 years, means hardly 20-30% results. So I'm just averaging out because of that.
Because now we see that increasing number of...
also one more thing, mobile phones, when people put in the pocket, it impacts badly their fertility and impotency both. Their potency and fertility both. So only by telling people to remove mobile phones from the pocket itself has improved it, just for your knowledge. It's very simple but very effective.
Earlier they said that don't put your mobile phones on your shirt pocket because it affects your heart.
It affects everything, trust me.
So it's best to keep your mobile phones away. Far away from yourself.
Yeah, as much as possible.
Okay, now can you also tell us if your Ayurvedic medicine can help female in the reproductive system?
Yes, absolutely, because exactly in the same manner as male, female also who are diabetic, they lose muscle tone, they lose the blood supply, the vaginal dryness is very much double than normal female.
The pregnancy?
It can impact the pregnancy as well. So we have treated lots of people who have pregnancy-induced diabetes, and it definitely helps a lot. Yeah, gestational diabetes, it definitely helps. But people, the women who have 45 plus and they get diabetic and their sexual, this one is reduced, desire or orgasm is not coming, whatever, I mean, libido is there, loss of libido is there. That time, a simple herbal preparation can help a lot.
I see.
It contains 1 teaspoon of fennel seed powder, quarter teaspoon of ajwain seed powder, 1 teaspoon of cumin seed powder, a pinch of asafoetida, and 1 teaspoon of shatavari powder. This combination generally helps with every woman who is menopausal and has difficulty in libido, loss of libido, reduced libido, dryness in vagina, everything. But Particularly diabetic woman has it almost 3 times more than normal menopausal woman. So they will definitely benefit from this.
So essentially you are trying to say that Ayurveda can help diabetics, especially in related complications.
Yes,
to do
very
better.
much, yes.
In what other ways can it help, in other than sexual issues? How about, are there medicines available for heart, kidneys, eyes, nervous system?
Yes. You know, Anil, I want to tell you one thing. Ayurveda is not just medicine. It's not a pill solution, but it's a solution which is holistic. So people sometimes think,
So it's not actually targeted towards one organ, it actually
no,
helps
it
the whole
is a
system.
holistic thing. It contains diet, it contains lifestyle, it contains specifically designed detox programs and herbs
Absolutely.
and Marma. So these are all part, and home remedies like what I was sharing right now, only from cumin and fennel and everything, you can actually just take care of yourself. So it contains everything together, and it is really working on the root cause of diabetes, which is what we call as metabolic syndrome. I'm talking about type 2 diabetes now,
Yes,
because majority people have that.
Right.
So I'm just focusing on that.
Right.
But metabolic slowdown is the key and the most important reason for type 2 diabetes. Of course, I mean, it comes from hereditary as well, but if you look at, people who keep their metabolism good, they don't get it. But people who don't work on metabolism, they definitely get it.
Okay.
So, on one hand, what we can do is that you suppress the sugar with something and do nothing about metabolism. Okay? But this metabolism, which is really bad anyways, it will always keep producing blockages and toxins, and it will then result in cholesterol, blood pressure,
All the related
toxins related deposited in the kidneys, or fatty liver, or heart problems, or toxins blocking the vein here and creating some retinal problem. Different things will come up. So Ayurveda focuses on mainly the metabolic balancing, activating the metabolism. As I told you that we believe the main cause is Dhatvagni. So our focus is activating the metabolic cycle completely in a manner that body itself is naturally healthy. So sugar is naturally good, other things are not naturally happening, and we at Ayushakti particularly have a diabetox program for diabetes.
Okay.
This diabetox program has a very specifically designed diet plans. Then it has lifestyle suggestions. We also
Can you tell us what the diet plan and the lifestyle suggestions are?
Yeah, the diet plan is basically fundamentally, I advise people to stay more on protein and vegetable diet. Okay, moong is my favorite because moong is detoxifying, it removes toxins, it activates metabolism, and it is high protein.
True.
It has a natural B12 and lot of isoflavin, which are very, very good antioxidants, So moong is my favorite, but we tell people to basically stay on lots of protein and vegetables diet. For diabetics, I specifically advise people to stop 5 things and rest of everything they can have, which is rice, because it's a simple carbohydrate, not so good, potatoes, fruits initially, and then once metabolism is active, I would recommend them to take fruit, but to begin with, fruits as well. Wheat, I tell them, is a poison. I have seen that people who stop wheat, in 2 to 3 months their sugar levels are controlled. It's amazing. I don't know, it's amazing, because wheat is very inflammation causing and toxic.
I see.
It's mucousy, so it blocks everything.
I see.
So wheat and red meat, these are 5 things I tell them to stop completely. If possible, even yogurt, because Ayurveda says yogurt is abhishandi, which means it is blockage creating.
Oh, really?
Yeah. So I tell them buttermilk is fine, Ayurveda says, but yogurt as it is abhishandi. So I tell them try and stop that as well. And on the other side, we recommend at Ayushakti every person that you take 70% vegetables in your diet and 30% protein, maybe just 60% vegetable, 30% protein, and 10% of carbohydrate, which will be containing only millet या ज्वारी की रोटी, बाजरे की रोटी, oats की रोटी, something like this, but not really wheat at all and no rice at all.
What about lifestyle, doctor?
Lifestyle, I definitely recommend. My husband is diabetic, as I told you earlier. He's never taken any allopathic medication in his life, and he's diabetic for 20 years. Only managed through Ayurveda and lifestyle and diet and detox. So he follows these things, and that's what I recommend everybody. Pranayam, Anulom Vilom, and Kapalbhati, because this is working on pituitary and hypothalamus and the whole metabolic central, system. So I definitely recommend pranayam. Then walking or exercise, as you know, compulsory. In fact, I would suggest every person who is entered 40 plus to start exercise every day if you want to prevent all metabolic syndrome. Even if you don't have diabetes, just take out time for yourself, 45 minutes every day, so that you don't enter this dangerous zone of diabetes.
Very true, very true.
Yeah.
I was about to ask you about yoga itself, but I guess you have already answered.
Yeah, yoga, I always tell people to do a combination exercises, Yoga is kind of stretches, which is good, but we need also aerobic type. So running, swimming, playing table tennis, dancing, aerobic, anything that can burn the calories also should be part of the regimen. So it should be a good mixture of stretches and aerobic, calorie burning, something like this.
That's actually the natural way, When you're working in the field, you work very hard, physical.
Exactly.
So
that's why, earlier times, former times, when Charak Samhita was written, this Madhu Prameha was not so popular. It wasn't so much. Because people used to work hard.
Basically a 20th century disease.
It is a side effect of success, I would call it. Stress, no exercise, only working.
Exactly. All about